Much of the day so far has been focused on a lot of the great research that's been happening around the university and research that's ongoing. And certainly when we talk about policy research, hopefully we all share the belief that one of the goals of that ought to be to disseminate that work and to have policy impact. LDI is certainly trying to make that a priority and try to scale up really what we're doing in this regard in terms of getting people's work out there. And there's kind of two ways to think about getting work out there. One is, at the time of research publications, making sure that that has, the right eyes on it and the right voices and ears listening to it. But also there's many debates that come up, of course, where there's a lot of expertise across the university that I think we need to get our voices out there on. I'm just going to cover a few introductory minutes and then start to hand off to our other panelists. So this was a column from the New York Times this past weekend that got a lot of academics upset, written by Nicholas Kristof. The title I think in the print edition was different and said something like Slim Impact or something like that. But the headline here online was, "Professors, we need you. Some of the smartest thinkers on problems at home and around the world are university professors, but most of them just don't matter in today's great debates. The most stinging dismissal of a point is to say that's academic." And then he said, "Professors today have a growing number of tools available to educate the public, from online courses to blogs to social media." So this was really meant to try to, I think, cajole us into kind of getting out there more into the public debate. For a more academic source, the National Academies issued a report back in 2012 lamenting to some extent like the lack of diffusion of science into public policy debates. As academics, I think often we feel like we should be having quote unquote evidence-based policy debates, and I think what the National Academy was arguing is saying, well, politics and policy are intertwined in one another, and what we really need is evidence-influenced politics. So we can never expect that just research is going to give the answers. Politics and evidence need to be wrapped together in some way, but we need to make sure that evidence is in fact making it into debates in the first place. So certainly there's a lot of new tools available to us in terms of thinking about social media, and that's what we're going to spend the rest of the time talking about. Blogs are a really important way to communicate expert opinion today, in addition to not so expert opinion as well, so it's a messy space. But blogs are a great way to editorialize on both research as well as news out there that has policy relevance. And certainly within the domain of social media, Twitter has become a very significant channel for communicating information and research findings, and has a way of operating that we'll talk to you more about that allows it to be better targeted towards specific audiences. So this is just a couple of examples of some major blogs that are out there. There are many others. Certainly the Health Affairs blog gets a lot of attention. The Incidental Economist is another blog that gets a lot of attention. If you don't spend time looking at these, I would encourage you to visit these websites as just two examples to see the way that they are being leveraged to editorialize on research that's being published, to editorialize on things that are happening in the news. And they've become a go-to place, I think, for both reporters as well as policymakers and staff to try to comprehend developments that are going on in the research world. Twitter, certainly as I mentioned, has become a very important channel. This little image up there of the guy pushing is my attempt to say that Twitter really has two main functions. One is for people seeking to push information out there, and so these are two examples, one from the Penn Twitter account and one from the JAMA Twitter account, where you can see, and these are hard to read, of course, but for example, Kevin Volp is featured in the Penn Twitter handle here, but just under that is Penn pushing out a research study that was just published out of Penn over the past week. And what you can see in that bottom one there, I guess I don't have a way to point here very easily, but that bottom one has a couple links in it. And so most people think, oh my goodness, what could I possibly say in 140 characters? That's like the biggest misnomer about Twitter. In fact, those little links in there, there's two links in there. One is linking to the primary research study. So if you get this tweet, you can click right on that and you're taken right over to the primary study. And that second link in there I can't even read it myself, but that's, I think, to the news coverage of that article that was published as well. So there's lots of ways that you can push out information using Twitter. There's also ways, and there's my little image of the guy pulling, which is the way that I tend to use Twitter, which is if you follow the right people on Twitter, your Twitter feed gets filled up with people who are kind of curating the news for you, curating research publications for you, and drawing them to your attention. So these are just 3 examples. 2 are from academics here, drawing attention to some research publications. One is from a reporter who just recently left the Washington Post, who is very well known for running a blog at the Washington Post with Ezra Klein, frequently covering a lot of developments around health reform. So I'm going to pass it off to Zach. We're going to get more into this stuff. Zach is going to talk about a research study that the 2 of us have been working on, looking at what academic researchers think about using social media for dissemination.
This project was really designed to ask researchers, particularly those engaged in health policy research, what they both think about and how they use social media and alternative ways to disseminate research, including their own. So the study that I want to share with you is a study that we designed to be both a survey but also had an experimental component. We went to Academy Health, their annual research meeting, which you all know is the largest gathering of health policy researchers. And so out of 325 pre-selected faculty members, academics who were attending the ARM, the annual research meeting, 215 participated in our survey, which had an embedded randomized experiment. A third of the group received a vignette about a researcher who has an important finding in health policy, and she not only publishes her research in an esteemed academic journal, but she also goes ahead and has the results released through traditional media to the rest of the world. The second group received a vignette about the same researcher who has an important finding published in a journal, but then tweets about it. And that leads to further pickup in lay press and lay settings. And then the third group had a vignette that was, again, similar, but instead of disseminating her work through media, social or traditional media, she meets with a council person from her local government and directly translates her research to somebody engaged in health policy. These were our findings. Basically, to break it down, our primary outcome was what these researchers thought across a host of domains, including the efficacy of the vignette, the channel that they received, the confidence to engage in that channel, peer respect that they believed the researcher would receive around this engagement, and questions around sort of academic promotion. And what we found, and as you can see, there's sort of the 3 groups. The blue represents traditional media, orange social media, and green direct outreach. That in the efficacy domain, there really weren't too many differences between the three channels. However, amongst the domains of confidence and peer respect and academic promotion, social media took a hit, and these researchers really were less neutral and more critical of social media compared to direct outreach and traditional media translation. When we drilled down about who was making some of these assumptions around these channels, we looked at the group by rank. In the efficacy group, it was clear that the more junior faculty were certainly more optimistic about social media than the more senior faculty. However, amongst the domain of peer respect, social media was appreciably lower than direct and traditional media, but they tracked together amongst assistant, associate, and full professors. We also asked about what actual research dissemination the researchers were engaging in over the past year, what activities they were engaging in. And just to sort of summarize what we found, only about 14% of the researchers we talked to were engaged in Twitter or tweeted about research. About 21% blogged about either their own research or other research. And actually, surprising for us, whopping 75% of the researchers we talked to, and this may be related to the group that we were interviewing at Academy Health, directly contacted policymakers as a way to disseminate research and data. The last part of our study was a more qualitative, open-ended piece. We actually recorded open-ended questions with this group about sort of high-level questions to talk about just using social media in general. And we analyzed it in a qualitative process that really produced 4 themes as best as we have analyzed the data so far. And they are that there was this concept of a cultural issue that people were concerned about when it came to social media. In general, we heard refrains such as, there's a lot of opinion out there and noise, and social media doesn't do a good job distinguishing sort of signal from noise. That was one concern. The second piece was that there was a sort of a real concern about professional risk for engaging in this process. Social media could lead to real risks that people felt if they didn't do it right, or they tweeted something that would be used later to against them. There was a lot of concern about the confidence, the ability to actually engage in social media, and people just felt that they weren't sure about how to do it, even though they were interested in doing it. And then there was uncertainty about the efficacy of this type of dissemination. And so that really summarizes our findings. We are going to try to use this as a way to launch into some further explorations of how researchers are engaging in social media. And I'm going to turn now the mic over to Raina Merchant, who is going to talk about actually using social media to engage in research directly.
So I wanted to spend a few minutes just talking about really the opportunities for social media, and I picked sort of Twitter as an example case. And there's this huge opportunity for the research community to engage in using Twitter for dissemination, but also for sort of the actual conducting of research. And so this is a non-exhaustive list of all of the different types of data that you could get from a Twitter platform. So information both about the person tweeting, so you can infer sometimes their age, their race, their geographic location, their likes and dislikes. You can determine their political associations. You can also understand more about how often they use particular social media platforms. And then there's a lot of information that you can get from the content. So you can get information regarding whether the tweet is positive or negative, if it's about a health condition, if the information is being passed along, if it's retweeted, etc. And we've partnered with the folks in computer science here to really automate this process of being able to go through huge amounts of data. And so we pull around 3 to 5 million tweets per day, which is really only 1% of the Twitter sphere. So you're able to get an enormous amount of data that you can cull through rather more efficiently using these automated processes. And there's a lot of sort of work in this area around Twitter and public health and also in public policy. A lot of that is in the area of surveillance. And so a lot of studies have come out of the sort of disaster and emergency literature where people are using Twitter to learn about emergencies early and for situational awareness. And then for message dissemination, which Zach and Dave talked about, for sentiment. So you can determine sort of the valence of a tweet just through automation. If it's overly positive or overly negative, you can use emoticons, you can use the words that are in tweets, you can pair the tweets so that you know what the other words are associated with to determine if the overall sort of feeling about a particular topic is positive or negative. We did this when looking at the shutdown, which happened this past fall, where we looked at around 3 million tweets in sort of a very short window to see if we could understand more about public sentiment related to potential health-related areas that may be impacted by the shutdown. So we looked at, were people talking about WIC? There were lots of concerns about what would happen with NIH funding when the government was shut down. CDC was actively tweeting, and then there were other organizations which sort of furloughed their Twitter accounts and didn't provide any information during the shutdown. And so we sort of did a really quick look at, could we see when there were spikes in this Twitter activity? Others have looked at comparing Twitter data with other existing data sources. So here they're tracking tweets with pollen counts to show that there were very close associations with where Twitter pollen counts were elevated and what people were tweeting about in terms of their symptoms. Similarly, people have looked more in the mental health space, and so tracked, can you predict postpartum depression just based on tweets of postpartum women? And they were able to identify sort of early on in tweets based on the types of information that people were sharing if they actually were then later diagnosed with postpartum depression. So it can be used in sort of this tracking. A lot of people are concerned about misinformation, and I think that that's a really big area of interest. And so there is a bit of information on Twitter which is incorrect. And here someone is saying, trying to find out how to get healthcare card for my uninsured urinary tract infection, needing antibiotics. If you have any left over, I'll pay you. So there's sort of this, that isn't the misinformation, but really this, these other sorts of things that people talk about or wanting antibiotics. And so there's a lot of, there's the ability to sort of tag these tweets for misuse or correct use or information that may be incorrect. To get to this area of like sort of signal versus noise, it's also possible to sort of tease out what information may actually be real versus random. So we looked at almost 100,000 tweets, and we're looking at resuscitation related terms. And we found about 25% of them were actually what we called real, and the other 75% were like, if I see Justin Bieber, I'll have a cardiac arrest, like very sort of unrelated. There is this ability, and so what we found in looking at some cardiovascular conditions, that tweets about hypertension are pretty much about hypertension. So it's not really used for other things. Diabetes is used a little bit more ambiguously. Heart attack is, the signal versus noise is very different, because I'll have a heart attack if I eat these French fries. Well, maybe, but is that really what they meant? A lot of heart attack in Justin Bieber, again, and celebrities, if I see this person, I'm going to have a heart attack. So there, the signal to noise is very different, but with some particular terms, like for AED or automated external defibrillator, it's also the currency in the UAE, and so a lot of the tweets around AED are not, in fact, about defibrillator, but they're about something else. But all of this is can be automated, and you can sort of figure out what the signal to noise ratio is. The last thing I'll say is that we now at Penn have a social media and health innovation lab, and so while I was talking about Twitter, we've done work with Facebook, with Yelp, with GigWalk, with Google Insights, with lots of different platforms that you could use both for research purposes or for thinking about how to disseminate research that's taking place. And now I will turn it over to Janet, who's going to talk about blogging at LDI.
How many of you know that we have a blog? Oh, that's good. It's especially good because it's soft. It's been in soft launch. We gave birth to it about 9 months ago, and it's been a very quiet thing, but we're ready for a much more broader launch. I can tell you about our goals. We want to lower the barriers to entry. This is not LDI's blog that you read. This is your blog, and the success of it is going to be whether we can get enough people interested to participate and to give their advice and to give their opinions and to actually blog. And so there are barriers, and Nick Kristof can say, the water's great, come on in, but that doesn't actually tell you how to blog. And so we want to give you a channel. So if you think of blogging as a time suck, if you think of it as something you have never done and don't want to do, I'm here to tell you that we are making it easy. You can blog once. You can interact with our blog in a number of ways. So if you're not comfortable simply blogging your opinion about something, you can give us some ideas. You can give us your papers and say blog about it. There are a lot of ways in which you can participate as you get comfortable. The way it's been working now in the soft launch is that mostly I see something or Dan sees something of interest in the news, in the literature, and we think, oh, so-and-so might have a valid opinion about this. And so one of us goes to that person and says, hey, let's say Mark Pauly, the CBO just came out with a report on employment, and the ACA, and people are saying it's job killing. Can you explain this to people? And Mark, being Mark, can give his opinion. And if you don't like the term blogging, you can call it invited commentary. And so in the course of a day, he writes something, and you can see that just happened a week ago. And he's got about, 1,000 words in there that is really quite a lovely lesson in means testing and why this matters. And so basically, if you look at it, this blog gives you the ability to ask Mark, what do you think? And so that's one way we're doing it, and we're hoping that in time, that these ideas don't just emanate from me or Dan, but that they come from you and that you get more comfortable knowing what you know and being willing to express it. And you can see that I asked Dave Rubin, who knows an awful lot about this stuff, when the issue of CHIP in Pennsylvania came up and the population's being moved to Medicaid, he had a lot to say. And so he did that. And I want to tell you a little bit about how it's working. You may very well say, okay, so you're lowering the barriers, but is it making any difference? Who's reading this? We actually have a tweeting strategy about it, and in terms of Dave Rubin's, that was picked up by WHYY, and that blog post was linked in Newsworks. And so we start to see a strategy to cross-post. And so Linda Aiken, who knows an awful lot about non-physician providers, actually was contracted to do a blog post with the Human Capital blog, and so we cross-posted. That was a huge audience. She sent something. We provide a lot of writing and editing assistance. You can send us things in practically any form, and we will turn it into a blog post. So you don't feel, it doesn't have to be completely polished. But we've also cross-posted with the Field Clinic, Rob Field is back there, the Scattergood Foundation, and we think that that's an excellent strategy and everybody wins because we get an audience we might not normally get. So here I want to tell you about how things actually work. I read an article, I actually got the article through Twitter, and it was an article by John Skinner. It was talking about technology as a cost driver. It was in the MIT Technology Review. And it basically said that the technology is a cost driver, but the answer is to pick technology that works, and that will help us. And I thought, okay, that's really interesting, and I know Pete Grunewald has a lot of ideas about the use of technology, the diffusion of technology. So I sent that article to Pete. He hadn't seen it, and I said, everything you want to write about? And he, in practically a day, wrote a fabulous post giving his opinion and saying that he would use that other article in his classes. Dan, as you can see, if you follow the arrow, tweets out, and that link is to the post. And Dan has roughly 900 followers now, which is big. So he tweets out to 900 followers, one of whom is Austin Fracht. Austin Fracht is the one who started The Incidental Economist. Austin Fracht has a much larger group. So he, if you can see, I don't know if you can read that, he says a gloomy but worthwhile read. That's it. And that MT is a modified tweet. And he sends that out with a link to 5,000 followers. And who picks it up but Atul Gawande, who basically just retweets. He doesn't modify the tweet in any way. He retweets Austin Fracht with our link to the blog. And Atul Gawande picks it up and sends it out to 89,000 people. So in the course of, I'd say, 2 days, we had a blog post that could conceivably be read, that was delivered to people's phones, to 100,000 people at almost no cost. And while not every post is going to have that kind of pickup, you can see where this is the way we can take what we have done today, once it's in the literature, once to take what you know, and to actually get it out there so that people can really see it. So it's broadening an audience. We We are very excited about the possibilities. You can interact in any way you want with this blog. And so at minimum, I would ask that all of you, as you know your paper is getting published, if it's online, send it, because you'd be surprised at the kind of angles we can take on it, which will help get your publication out. It will also get our name out as LDI. We're going to launch fairly soon with a new name. And then you'll be hearing from me if I don't hear from you, trying to tap into your expertise. And I think if you find out from we've got about, 40 posts up, and about 15 people other than me have blogged. And if you ask them, I think you would find that they found that to be a very easy experience. And it's not something you should shy away from.